endometriosis is a systemic disease. You see the impacts in the brain. You see sometimes women have these lesions in their lungs and their diaphragm. So we have to get away from thinking that it's just about retrograde menstruation. My name is Lacy Alexander. I am a professor of kinesiology and of obstetrics and gynecology. Endometriosis Awareness Month is 1 month dedicated to education and bringing public awareness towards this female reproductive disorder. There are typically extra conferences. You'll see extra attention in the media, as well as some famous people, if you will, that will tell their stories about their journey with endometriosis. Endometriosis impacts approximately 6 to 10% of the female population. When you look at that, you may say, 10% of women in reproductive age, it's actually a lot of people, and it goes underdiagnosed most of the time. So many people may have symptoms of endometriosis, and yet the literature suggests that they see 6 to 10 physicians before they're diagnosed, which leads to a delay in diagnosis and a delay in treatment. Endometriosis presents with an array of different symptoms. It may be painful periods, it may be pain with intercourse, but there can also be bowel-related symptoms, painfulness with defecation. It can not only be around the time of menses, but it can be at other times in the cycle as well. Endometriosis also has several different comorbidities associated with the disease. So women with endometriosis are more likely to suffer from depression, anxiety. As we've shown and the literature has shown, they're more likely to develop cardiovascular disease earlier in life. And essentially it's a disease of systemic inflammation. So many different symptoms that go along with the systemic inflammation. The extensive comorbidities, many women will seek care from primary care physicians, they'll seek care from their gynecologists, they'll also perhaps seek care from a psychologist or a psychiatrist. But I think what it boils down to is that there's a lack of education, and there's even a lack of education and appropriate training in our medical profession. So we need to better educate and make our medical profession aware of the symptoms so that they can recognize it early and lead to better treatment outcomes. Endometriosis isn't given the same attention as you might say breast cancer for Breast Cancer Awareness Month. And I think it's because it's a difficult conversation to have. We as a public have steered away from talking about menstrual cramps. We've steered away from talking about pain with intercourse. And so having people like Bindi Irwin and other celebrities who come out and tell their stories and talk about the infertility that endometriosis is associated with and their struggles, I think brings the condition into the public relevance. And for that, I think that Endometriosis Awareness Month is really beneficial. I think that we have a month of awareness for endometriosis, but it's not just 1 month, and these women live with this condition chronically. Typically, women start having symptoms in and around the time of their initial menses, and they'll continue to have symptoms throughout menopause because it's an estrogen-dependent disease. So, we have this awareness month, but if you know somebody or you yourself have endometriosis, I think the lesson is that you're not alone. We listen to you. We're doing extensive research to figure out not only the origins of the disease, but also a lot of the comorbidities and how to reduce long-term risk for you. So call your congressman. Please, funding for this type of research is extremely important, and it's an underfunded disease that we need help to help you.